It has been a long-time desire of the Langdale Company to provide telemedicine services to our employees. Through a partnership with a rural hospital, a mobile medical clinic was acquired to better serve our employees, especially those in rural areas with limited access to healthcare. The mobile clinic provides quality healthcare services at the work site, which keeps our employees well and minimizes the out-of-work time for employees. Employees visit the clinic without having to clock out or take time off. Patients are given a mask and their temperature is checked upon entry to the mobile unit. A new patient completes new patient paperwork. Privacy is strictly adhered to, and the patient is interviewed behind a closed door. Jennifer enters the new patient information and current symptoms into the computer system, which the healthcare provider accesses during the patient visit. Sunny obtains vitals, such as weight, height, and blood pressure, and the current symptoms. We have a digital stethoscope that allows the provider to hear and monitor heart rate and lung respirations in real time. Once the patient information, vitals, and current symptoms are entered into the system, the patient is placed in a virtual waiting room on the telehealth monitor. The medical provider appears on the screen where the patient and provider can see each other. The medical provider interviews the patient with Sunny and Jennifer aiding with diagnostic tools to help the provider diagnose the patient's condition. This patient presents with a complaint of a sore throat. Sunny uses the horoscope to show a live view of the patient's throat to the medical provider. The provider can then ask Sunny to zoom in, adjust lighting, or tilt the lens to obtain a better view. The provider sees that the patient's throat is red. She asks Sunny to conduct a rapid throat swab strep test. The test results are available in 5 minutes, and the result is positive, which results in the provider calling in an antibiotic to the pharmacy. If needed, cultures may be sent to the partner hospital lab for further examination. The patient also complains of a mole that has been bothering him for the last few months. Again, the provider asks Sunny to use the horoscope to measure and show the image to her via the live view. If the provider feels that additional tests are needed, a specialist referral will be made and an appointment scheduled. The horoscope has many lenses that will allow the medical provider to view a patient's mouth, ear, skin, and an ophthalmoscope to view the eyes. Screenshots of the live view may be taken and saved on a secure platform for the provider's documentation, if needed. Once the medical provider has all the information, makes a diagnosis, requests a follow-up visit or extra tests, and/or prescribes medicines, the provider ends the session. The patient is instructed to pick up prescriptions from the pharmacy, follow up with a specialist if needed, and then the patient returns to work with minimal missed time. The goal is to provide the patient with access to on-site medical care, pharmacy, and labs with minimal missed time from work. Subsequent visits to the mobile unit take less time as the patient is already registered in the system. What is the employee cost? $0. The physician visit, pharmacy, labs, X-ray, and diagnostic imaging are provided free of charge by program partners. The clinic has a supply of over-the-counter medication that is available at no cost to the employee as well. The clinic also has the ability to perform a 12-lead EKG for a patient who is exhibiting heart attack symptoms, including chest pains, heart palpitations, tightness of the chest, profuse sweating, pain radiating in the left arm, high blood pressure, nausea, and/or vomiting. If a patient is in an emergent situation, the provider and clinic staff can triage and monitor the patient while EMS is en route. Benefits of this program include $0 cost for labs, X-ray, and diagnostic imaging performed at partner hospital. Phlebotomist on-site at clinic to draw physician-ordered labs. Mobile telehealth services available. Physician visit, labs, EKG, urinalysis, glucose test, A1C, instant tests, flu and strep, X-ray and diagnostic imaging, ultrasound.